So when children have dyspraxia, at an early age they will have difficulties in achieving gross motor milestones despite having good muscle strength. So remember that in cerebral palsy, in Down syndrome, children actually have some muscle dysfunction. The muscle itself has some lesser capabilities, you could say, by birth. The muscle capabilities, the muscle properties are a little different than the regular typical children. However, in children who have autism or autism with dyspraxia or learning difficulty with dyspraxia or ADHD with dyspraxia will have certain different profile. The profile is that the child has very normal muscle strength. The child apparently is well in terms of the physical small movements, suppose moving the hands, moving the legs at that age. However, they still are struggling to learn certain skilled movements. For example, at 2 years of age, children usually learn how to jump with both feet together. They need to know that jumping is not like this. So I'm showing with hands, but assume that these are my legs. Now, when you tell a child to jump and he's jumping like this, it means he's jumping with one leg at a time. Whereas jumping means this, right? Even if the child is holding your hand, it's okay if the child is holding your hand. At 2 years of age, they don't get independent jumping. If you are holding the child's hand and you're asking them to jump, one of the difficulties that you might see in dyspraxic children is they start looking at your face as if they are telling you, what do you mean by jumping? What does jumping mean, or how do I jump? Then you show them this is how you jump, and then you say, okay, now you do it. And then they again are not able to do it. On one side, this is the physical aspect side of dyspraxia. The other side of dyspraxia is that the child has difficulties in acquiring speech, even if the child has good oral motor, good oral sensory. The child is probably singing songs or singing the entire rhyme, but the child does not still say even two words meaningfully. So how is that possible? Because if the speech is not good, if the sound production is good, that is why the child is able to do rhymes and songs. But despite doing songs and rhymes and other things, good control over your mouth, which is physical control of your mouth, is good. But even then, you are having difficulty in teaching the child how to speak or how to express the needs. I want biscuit, I want dash is taking long time. What that means is that the child has some kind of dyspraxia affecting his planning abilities, affecting his ability to plan from here and bringing it to here. In terms of physical, planning is here and then implementing with your hands or feet. What you should be doing with such children is that you will have to uh, deliberately create some challenges or physical challenges for the child. For example, usually when children are not able to learn physical abilities, they are told step by step. Okay, take your feet up, then take your feet down, then take your other feet up, then you and this is how or they help the child. The parents are helping the child too much. They're holding their feet, holding the hands, and making them do the task. Remember that when children have difficulties with dyspraxia or motor planning, they need to figure out themselves. They need to figure out how to do it, but you can show them the end product. What do I mean by that is, you don't have to show them that step 1, fold this paper like this. Step 2, fold this paper like this. So now this is ready. Instead of that, you show them the final product which you have done somewhere else. You have done in the other room. You show the final product to them and you say, I want you to do this. Try yourself. I want you to get this paper folded. Try yourself. See how it is to be done. Try in the sense, let the child struggle a little. Let the child fail a little, because he's looking at the final product and trying, but he's not getting it. But you don't have to really go step by step and tell the child again and again about steps. Let them figure out by themselves. Cycling, for example, is very difficult for children who have dyspraxia to actually learn cycle. They take a long time to learn cycling. They take long time to learn jumping. What you do for again for those activities is you show them how to cycle by you cycling, and you say, you see how I am doing. But then you make them sit on the cycle and you say, you try. You try how it is to be done, like I showed you, like I told, like did before you. So you try to give them the end result or end product by visual demonstration, but don't help them too much, don't help them physically so much that it's like they are not doing much about by their mind. It's more your hands doing for the child. Don't do that, but give them the visual demo. Same is for imitation. When you tell a child, do this, and the child is trying to do, he's trying to figure out where should my hands go? Should my hands go here or here or here or here? Where am I supposed to go? That's the time you are already triggering good motor planning abilities. So ask the child to do lot of imitations. That would trigger a young age child at 2 years, 3 years of age. Imitation is the best. Asking them to imitate, but not holding their hands. Remember that you don't have to hold their hands and do it. You have to show them, and you say, now you do it.